chercher en loi. Nous seule loi pour nous faire un enchant. Et longtemps n'a bousqué en loi. Loi mentale qui pour dire fierté nous. Dignité pour toute frère nous yo. Dignité pour toute yon nation. Yon nation, même aspiration, même devise, même croyance.
That earthquake 2010, that's really a earth killing. Because of that earthquake, we had more kids from parents that disappeared, they don't know if they are alive or have amnesia, they forget about where they were. From people that lost their job, their house. Because of the financial situation in Haiti, a lot of parents, they have a tendency of give it up. This is why they have a lot of orphanages in Haiti. Kids are deprived of everything. Because most of those people, they don't have a good education that can give them strength to do something positive with their life and raise their kids. So the first thing, the easiest thing to do is just give up the kids. I'm the founder of the Rubble Foundation, which was created 20 years ago. At first, it was just myself and a couple of friends and the family who helped sponsoring the foundation, help it going, sending kids to school, provide them clothing, food, shelter, and everything. And after 2010, after the earthquake in Haiti, we found Dr. Bull Durham from Arizona. He came to the foundation with two of his friends. He really put us back to normal because they had sponsored some of our kids by paying their tuition and especially provide us what we really need, which was a lot. They had given us a washing machine to prevent skin disease. That's a great help. We have a beautiful and big oven. They also provide us with a lot of kitchen utilities, like big pot to cook and everything. We also have a generator that provides us light. And they also give us backup light, which is an inverter. And then they still continue to bring people over, take our kids to their hospital, wherever they are. So we are really spoiled and lucky to find those people.
Yon pays cap liter, yon pays cap chanter, yon pays cap marcher, chercher vérité. Yon pays cap liter, yon pays cap chanter, yon pays cap marcher, chercher vérité.
There was an attachment between the Flagstaff people and the Haitian people early on, and then word just sort of spread around the community. People wanted to contribute something because the earthquake was so devastating. 300,000 people dead in that earthquake, and 2 million people in the city. Half of those people homes were destroyed. I mean, it was a huge event. People came down, they developed a connection to Haiti, they developed a love for Haiti, connection to the people, and a respect for these people who have been through so much and yet are so resilient and positive and pleasant, and actually seem to be extremely happy in a situation that to us looks incredibly dire. One of the issues that we face is that we have a short-term memory in the U.S. At the time of the earthquake, the amount of relief that came into this country was was incredible. And as time has gone by, that relief effort has waned as we have sort of forgotten about what happened here 2.5 years ago.
After the earthquake, I can tell you, a lot of hospital crashes. We had a lot of patients. We couldn't take in care everybody. We had help from international people come from outside, put tent hospital to help everybody. And after the earthquake, a Project Medicare joined us. I think we feel now this country can't live without an hospital with intensive care unit, because before this we lost a lot of patients here because of that. We didn't have this expertise. It's a lack of funding and it's a lack of a strong healthcare system in Haiti. All the patients coming here, they are low-income patients.
Up until November of 2010, really, the care provided here was free. As Medicare moves forward, the plan is to move that into a more economically sustainable situation where patients would be on some type of a graded system, and then there would be a graduated financial schedule in terms of what people can afford.
We're fortunate enough to have good friends around the world, from Canada, from the United States, that bring specialists here and give of their time, but the technology, equipment, and cost to provide that care is something that is not sustainable without continued support. What our hope is specific to Haiti is that we'll be able to engage the Haitian government in reviewing and supporting trauma and critical care support in the state of Haiti, along with private investors, donors, groups like the American Red Cross, JESCU, just to name a few, that would be able to help support the level of service that the Haitian people deserve.
The worst case scenario, if in January 2013 we don't have any budget to continue the project, we are going to close. At this moment, we have to close.
When we bring down a full team of volunteers from Flagstaff, they do everything here. We've got pediatricians who have come down on this trip. We've got pediatric nurses that work in the pediatric intensive care unit. We also have surgeons who have come down on this trip. We have a general surgeon, 2 orthopedic surgeons, an anesthesiologist who are all working in surgery, providing care to trauma victims who come in here on a daily basis. So everybody comes down here, pays their own way, takes time away from their friends and families, and takes time off work for that. That's all uncompensated.
Started to work with Dr. Durham, and I came here 2 years ago after the earthquake, and we worked for a week, and it was a very good experience for everybody. It was very hard for the people here. They were very under a lot of stress, and the conditions are very hard for them. It's a great experience for me because I'm learning and I can see, even if you're going through a hard time in life, you still need to keep hope, and this is what they're doing. What I like is just being able to be with the patient here and being able just to be helpful and trying to make a little bit of the day easier for them. I can help with translation because I speak French. So this is the triage part of the hospital. The patient comes here first in the morning, they sit here, and the nurse are going to try to see which one of the patient is the most urgent, so they will go next to the tent where they will be having first aid. So they are trying just to make sure that they are looking for the most emergent patient to take care, and then since I've been here, I've been noticing a little things that sometimes it's nice to help them getting better and improving their skill, but I must say I'm very impressed with the training and what they're doing here.
Hôpital Bernard Muse is the name of the hospital, and it's the only hospital in Port-au-Prince that has ICU beds with ventilators. Flagstaff, we have an ICU that has, 30 ICU beds for a town of our size, and we're talking a city here of 2 or 3 million people, it has 3 ICU beds, and so that gives you an idea of the lack of resources down here.